so this is my very nice patient who came to see me with the droopy eyelid problem. He was having quite a bit of trouble with the vision. And so he elected to have droopy eyelid surgery or blepharoplasty. And so this is what he looks like today. And so he is at his, how are you?
I'm fine.
And this is him at his 6-week post-op. And so you can see the actual lid margin, and it looks nice and normal. You can see his lash line. There's no lid covering him, blocking his vision. In contrast to this picture, where he looks like he's scowling, but he's not. But he's got all the skin covering over his lid, and this is after surgery. So much better. And so I'm going to ask you just real quickly. So why did you have the surgery in the first place?
Because of what you said, the skin drooping, and it was causing my vision. I'd have to always raise my brows to see anything clearly, and it wasn't very bright. My vision wasn't bright.
That's right. Did you notice also driving? Did you feel like it was blocking the sides of your vision?
Yes, I did.
Yeah. And so the surgery, how was it? Was it hard? Was it easy? What do you remember?
Well, it was hard.
Yeah.
And it felt like I'd been hit with a baseball bat. But
yeah. Well, these are all honest answers, and we need to hear this.
And but I got over it, and I'm really pleased. I'm glad I did it.
So how long did it feel like you got hit with a baseball bat? How many days?
About 5 to 7.
5 to 7 days. And
yeah.
I'm sure it got real swollen afterward?
It did.
And you did the ice and stuff?
I did.
Right. So again, about 5 to 7 days, about a week of just dealing with, was it discomfort, or was it, what were your kind of symptoms, besides the swelling that you were having?
Yeah, it's very uncomfortable, but nothing intolerable.
Sure. And you could still
I didn't have to take pain medication.
Oh, you didn't? Okay, so you didn't take any pain meds. So it wasn't that bad.
No, sir.
But enough that obviously it was, versus not doing surgery, it was a recovery.
And going to church, it was kind of, at first I was afraid to go
a little
because I thought
embarrassed.
everybody would laugh at me, but then I went on and went without sunglasses, and it was okay. Everybody that I saw me, I told them what happened, and they were really pleased and watched the progress on me, and have commented how much better they thought I looked.
Yeah, absolutely. And how about the vision? I take it the vision was still okay throughout the process?
Oh, yes.
Yeah, and that's what we hear. Most people, it doesn't really affect the vision.
Mm-hmm.
And like you said, you're black and blue and so forth. And so how about now? What do you think about the vision now?
Oh, I'm really pleased because everything's much brighter, and therefore the clarity is there also. Right. And I'm just very pleased.
I'm glad to hear it. How about the driving? You noticing you can see more peripheral?
Yes.
Right. Well, great. So if you have someone who tells you, that they got this droopy eyelid issue and they're contemplating this surgery, what would you say to them?
I would say to come and see you, Dr. Kim, and that it's worth what you go through to get it done, because it can really affect your life and your ability to see.
That's right, and that's what the name of the game is, right? It's
yes,
not
it is.
Just to make you look better. It's really so that you can see better. That's the
Absolutely.
whole purpose of it all.
Yes.
But it's a bonus treat when we can get you looking nice and fresh and normal the way you should look. So thank you so much for sharing your story. We really appreciate it.
Okay, thank you too.
Thank you.